Good morning. So I just wanted to give you a brief rundown of a couple of experiences that I've had navigating patients. I had the opportunity to navigate a young lady, 19, on labor and delivery. She was 5 months pregnant. This was her fourth pregnancy, but third live birth. She was a little bit scrambled with the information she was given. So when I was trying to get pre-existing health information, demographic information, she was kind of all over the place. We One of the beautiful things about working at the care center and being a navigator at the care center is I not only have the opportunity to navigate patients from in services in the emergency department located in a hospital, but I have the opportunity to actually go out to patients' homes and try to engage them. So with this young lady, I had the opportunity to go to her home and speak to her, Miss Cooper, myself, Dr. Fitzpatrick. We wanted to try to figure out what exactly were her issues, what was keeping her from being actively engaged in care. We thought that it was just her not being medically compliant. She had had a history of missed appointments with her. I mentioned she was 5 months pregnant. She had accumulated $275 worth of fees because she constantly missed appointments. And in interacting with her, she would ask me little things about health forms for her children, if I could meet her at the school to help her fill out the paperwork and things for her children at school. Lesson learned, she wasn't medically compliant. She had difficulty reading. None of the other places that she'd gone to before had noticed that when they gave her the appointment card, she couldn't quite understand that she needed to come back October 15th at 2 o'clock. She couldn't read October. She knew it was Tuesday, but she couldn't read card. I think that's one thing that a lot of people just automatically assume that when you come into a health setting, that everybody can read and everybody can understand and comprehend on a level that you're 20, you're 19, you're 25, certain things you should know. She did not. I still go to her house. I still pick her up for appointments. But one thing I have to say, with all of the navigation and hand-to-hand work that we've done with her, her babies are healthy, nobody has HIV, and she is medically compliant. I had an opportunity to meet with another young man in the emergency department at United Medical Center, 22, young, black, homosexual. Being a navigator, I reach out to patients weekly to keep you engaged in care. It took 60 days to get him to come into the hospital because he was afraid, didn't want anybody to see him. So after work, I would meet him at the Rite Aid on South Capitol Street or the public park across from the Rite Aid on South Capitol Street. And it took a lot of prompting and hand holding, but eventually I too got him ready and mentally prepared to come in to receive health care from Dr. Fitzpatrick. He too, undetectable, medically compliant, and going to the Navy.